this year marks the 20th anniversary of the World Health Organization Framework Convention on Tobacco Control coming into force, a landmark treaty that has shaped global efforts to curb tobacco use. South Africa was one of the first signatories and is now on the brink of strengthening its commitment with the pending Control of Tobacco Products and Electronic Delivery Systems Control Bill. Recent years have seen consistent increases in tobacco taxes, contributing to a steady decline in smoking prevalence. The call is being made for continued and concerted efforts by government and society towards a smoke-free South Africa. Deputy Director at the National Council Against Smoking, Dr. Sharon Nyatsanza, joins us now via our video link for more on this discussion. Dr. Sharon, thank you so much for your time this evening here on SABC News. I mean, the fight against, or for a smoke-free South Africa really is never-ending. Perhaps let's start off by reminding our viewers when it comes to the problems associated with smoking and why we continue to highlight these issues.
Thank you so much, Bali, just for taking time to talk about the problem of tobacco, because while there's been steady, progress in trying to combat the problem, it still is a problem. Tobacco kills more than 30,000 South Africans each and every year, and it really is a cause for most of the NCDs, the non-communicable diseases. So it is a cause for cardiovascular diseases, for cancers, etc. Some of the NCDs that are ravaging the country. And I think it's also important to note that it's not just a health concern. It's also a social and environmental and economic problem. South Africa currently uses about 42 billion rand each and every year to treat the diseases linked to smoking and also due to lost productivity. So smoking still is a reality and it still is a problem. Our latest studies actually show that even though there was steady progress, declines, we're starting to see an increase in smoking rates, especially with the vapes and the new electronic delivery systems that have now entered into the market.
And maybe just give us an insight in that regard when it comes to some of the statistics looking at this new trend of vaping. I mean, when it comes to smoking as well, some people say that, well, it's an easier way of, trying to let go of cigarettes and, they then diverted to vaping. What are some of the myths we are also seeing in that regard when it comes to the using of vapes?
Yes, so I think just to start with smoking, around 1994, 32% of South Africans were smoking, and that number came down to around 20% around 2012. But the latest data from 2021 shows about 25% of people smoking the traditional cigarettes. In terms of the e-cigarettes, what we see is that around 4% of South Africans are using vaping. But the challenge with the vaping as well is that the studies are also showing that a lot of the users are not the adult smokers, which we would obviously expect if this was an issue of quitting smoking. But it actually is a lot more of the younger ones, the 16 to 25, that's the majority of people who use e-cigarettes. A study which was done in Cape Town among grade 7s to 12s was very, very shocking, showing that around 40% of those children were using vaping, and a lot of them have to vape within the first hour of waking up. So it really is a concern, because what we're seeing is that even though, yes, we still have smoking increases, the significant increases are on issues like vaping. They're on issues like Hubley as well. Hubley is another problem that we are facing right now.
Why do we see the sudden spike, particularly the age group you are making reference to, looking at teenagers who are using vapes? I mean, what are the contributing factors in that regard to seeing this sudden increase there?
So if we look at the Framework Convention on Tobacco Control, the treaty was celebrating 20 years. It focused on traditional tobacco products. So South African law right now, as it stands, it controls tobacco products. But vaping is not a tobacco product. So because it's not defined in the current laws, these products have managed to escape regulation. So you would see, for example, that you no longer see a Marlboro billboard in South Africa. You will no longer see, Marlboro being sold in the middle of a mall in South Africa. But now what we see is vaping billboards across our freeways. We now see a lot of vaping shops mushrooming almost across the country. So it's an issue of the working tobacco control was trying to denormalize, making it acceptable not to smoke. But with vaping, it's almost like undoing that, because now we have, I'm sure the audience has seen this, colorful vaping products. They are marketed in a way that actually attracts the youth. Even if you look at some of the flavors, it's like cherry, bubblegum. These are even the cartoon characters in some of the products, so they actually are targeted at the youth. And obviously the challenge is that for the past 10 years, they are not regulated.
Yeah.
So no one is controlling how they are marketed. No one is controlling even the ingredients within the products. And that is what we really have been advocating for, to say these must also be regulated, and otherwise we'll have a big public health problem.
All right. And Dr. Sharon, when it comes to trying to curb, this increase in smoking in the country, would you say that an increase in taxes is the answer in that regard to deter more South Africans, to not even touch tobacco?
So taxes are still a key part of tobacco control. I wouldn't say that that is the only way to do it, but I would say it's a significant part to tackle the problem of tobacco. The challenge with tobacco, vaping, a lot of the consumer products is that you cannot address it just looking at one measure, which is taxes. So definitely we do need increased taxes. But for taxes to be effective as well, they have to be above inflation. If we have an increase of 50 cents, it's below inflation. It will not make an impact. Taxes only work when they are above inflation and they make the product more expensive. But unfortunately, what we are advocating for as well is that it has to be a comprehensive address of the issue. It's not only taxes, it's about how you package it. It's about health warnings. It's about providing cessation support for those who want to quit. So it's about controlling all these other angles, because once you control one area and leave the other one open, the industry manipulates the area where you leave the area unaddressed.
And looking at vaping once again, you've painted a very bleak picture of how this industry is not even controlled. And at the same time, it really is a big business. In most shopping centers and malls, you do come across, vapes. And at the same time, the vaping industry is also asking, for less taxes on them. What is your reaction to the vaping industry who are asking for less taxes?
So I think for me, the first thing to clarify is to understand who the vaping industry is. So for example, the people who own Vuse are the ones who own Marlboro. The vaping industry is the tobacco industry. So it's the same companies that actually the majority of the vaping companies are owned already by the tobacco companies, the people who are selling the traditional cigarettes. So I do not think that they must get differential or preferential treatment. The products must be regulated strictly, because really, for me, it's about prioritizing public health. So does it mean that if we have the bill, for example, the bill in Parliament passed, it doesn't mean that people cannot buy vapes. They still can buy vapes. They still can use vapes. But we're trying to strike a balance. We can still ensure adult access. Adults can still use it, but we try and reduce the hooking of the younger generation. And I think that is a fair balance to strike. So obviously the issue around the economics always comes into play. But I think I just wanted to, reiterate that, for example, with tobacco, government gets about 14 billion rand in taxes from the tobacco industry. But government uses 42 billion in treating the illnesses and lost productivity. For every 1 rand government gains, they actually lose 3.40 rand. So tackling tobacco still makes economic sense. And obviously, even when we have these bills or these regulations passed, people don't quit automatically. It's something that happens over a long process of time, which actually also allows our economy to actually adjust.
All right, Dr. Sharon, thank you so much for that insight. That is Dr. Sharon Nyatsanza. She is the Deputy Director at the National Council Against Smoking, just giving us there an insight and painting a picture of what the smoking industry looks like now.